Good evening, everybody, and welcome to Learners' first webinar of 2022. Can I welcome your questions to Dr. Muter at the end of the talk, please? All questions for the Q&A, please use chat to post them. And the video of the webinar, together with Dr. Muter's PowerPoint slides, will be posted on the Learners website in the next few days. So if you miss anything, you can go back and have a look there. Dr. Valerie Muter is a clinical and research psychologist with a special interest in children's early cognitive development, particularly in relation to language and literacy. She was a consultant pediatric neuropsychologist at Great Ormond Street Children's Hospital for over 20 years and is currently an honorary research associate at University College London. She has published over 30 articles and books in the field of neuropsychology, language, and literacy. And I'm very pleased to be able to welcome Valerie to present our webinar tonight. Over to you, Valerie.
Thank you, Richard. I'm now going to share my screen. Thank you very much to Learners for asking me to give this webinar. As you all know, Learners is here as a platform to inform the public of research and to look specifically at how research can impact our day-to-day lives and in particular how it can be applied to practice. I'm a cognitive neuropsychologist and my life work has really been devoted to the field of child literacy and in particular how we can help children learn to read, as this is one of our most critical life skills. Let me just begin by describing the structure of this presentation. I'd like to begin by describing the importance of reading, and then I will present two longitudinal studies. A longitudinal study is where you take the same group of individuals, in my case children, and you follow up the same group of children over a period of time in order to look at the causal interrelationships of the variables involved. I'm going to describe two longitudinal studies. I was the lead researcher on the first of these. This is a longitudinal study of typically developing learners during their first 2 years at school between the ages of 4 and 6 years. The second study is also a longitudinal study over a very long period of time, and I was involved in the last stage of this study. This is a longitudinal study of at-risk learners from dyslexic families who were seen from preschool to early adolescence. And what I'm going to do after I've described these research studies is to consider the impact of their findings. The first study will look at the impact on our understanding of the processes involved in early reading development, and I'm then going to discuss in practical terms how this understanding of these processes affects classroom teaching methods, early screening and identification of children who are at risk for reading problems, and how importantly we need to integrate oral and written language in helping children learn to read. The second study, which is the at-risk learners from dyslexic families, I'm then going to consider the impact of this study on how we understand variation in expression of children with literacy difficulties, how they vary one from the other. And then I'm going to go on to talking about how we should assess and teach these children and how we need to take account very importantly of what we call co-occurring or accompanying learning problems. Let's start off by considering why reading is so important. In Jerry Altman's amazing book, The Ascent of Babel, which he wrote in 1997, he describes reading as one of mankind's greatest achievements. He says, "It is only through writing that almost all that is known today is known at all. Science and history simply relies on too much information for it to be passed down through the generations by word of mouth alone." In other words, we need some permanent representation of what we know so that we can pass it on to others and from one generation to the next. Now, learning to read is arguably the single most important educational challenge facing primary school children. The majority of primary school children will have no difficulty in accessing print, and by the age of 6, they have a very broad reading vocabulary. However, we do know that substantial numbers of children find learning to read inordinately difficult. It's been estimated that 1 in 6 children fail to read at a level that enables them to comfortably access their school curriculum. Why are the beginning stages of learning to read so critical? I'm basing this on a very long-term longitudinal study that was carried out by Cunningham and Stanovich in 1997. And they say that the rapid acquisition of reading abilities helps the development of the lifetime habit of reading. They found in their study that if children made a good start in learning to read in grade 1, by the time they were in grade 11, and in adolescence, they were reading more and they had a good understanding of what they read, in contrast to the children who'd made a slow start in learning to read in grade 1. We know also that a poor start in reading has a long-term detrimental effect. There's a very famous epidemiological study that was carried out by Michael Rutter and his colleagues on the Isle of Wight in the 1970s. And in this study, they identified a group of children aged 9 to 11 years who were having inordinate problems in learning to read. They were described as children who had severe reading retardation. Their reading standards were far below expectation. Barbara Morn and Michael Rutter had the opportunity to revisit this group of children decades later when they were in adulthood, indeed approaching middle age. And they found that those children who'd been poor readers at ages 9 to 11 still had problems even when they were in middle age. Although they could read reasonably well, they were very poor spellers. They did not regard themselves as upwardly mobile. Few had obtained formal qualifications, and they were generally in manual jobs. So learning to read is very important. The first study that I'm going to look at is one in which I was the lead researcher. It's a longitudinal study of typically developing children from age 4 to 6 years. And we were very interested in the processes involved in learning to read at the beginning stage. And we know that this is important because we can't easily appreciate the underlying difficulties of the child with a literacy disorder unless we have a good understanding of the skills and processes that are needed for learning to read normally. So this understanding of these processes stems from what is called predictor-based research, both in typically developing groups, normally developing children, and high-risk groups, such as children who are born into dyslexic families. Now, these predictors are skills or factors that are clearly definable and which contribute to literacy development. Not only are they definable, they also have to be measurable, either through rating scales or tests, and they should also be potentially modifiable through teaching. Now, predictors can be of two types. They can be cognitive predictors related to learning, and examples of these would be memory, or, as I'm going to talk about shortly, phonology, which is children's understanding of the speech structure of spoken words, or they can be non-cognitive, typically environmental, such as the important role played by parents and teachers. And it seems that the first 2 to 3 years of learning to read are especially critical. Foundation skills are established during this time, and reading skills stabilize from age 8 onwards. You get very few changes in reading patterns or trajectories of reading after the age of 8. This measure of phonological skill is critical in learning to read, which is why I've included this diagram, because it explains the developmental progression of phonological or speech sound processing skills. Let's look at it in relation to chronological age. On the left side of the diagram, we're looking at children aged between 4 to 6 years. And then in the middle section, I've described a variety of phonological tasks that can be used to measure phonological skill. At age 4, children are expected to know nursery rhymes. They can very often blend syllables. So if you say to them, blend the syllables car and pet, they can tell you that that makes carpet. By the time they're 5 years of age, they have an understanding of, for instance, alliteration. They know if 2 words begin with the same sound. By the time they're 5 and a half, they're beginning to have an even more sophisticated understanding of the smallest speech unit of words, which is the phoneme. So they can identify beginning and end phonemes within words. They know that the word cat begins with a k and ends with a t. And by the time they're 6, they can manipulate sounds in words. So they can delete beginning sounds from words, such that cat without the k says at. And the development of these phonological skills, which become increasingly refined and fine-grained, coincides with their print experience, which they have at school. They begin at age 4 learning the letters of the alphabet. By the time they're 5.5, they should know all the letters of the alphabet. Coincident alongside this is the building up of a sight word vocabulary of high frequency commonplace words like then, dad, to, and so on. And by the time they're 5.5, they're beginning to develop what we term phonic decoding skills. They can sound out words. Now, we do know that phonological skills are very important in learning to read. And one of the most important models that we had was a model that was developed by Peter Bryant and Usha Goswami in 1990. They placed particular importance on rhyming and reading. And indeed, they suggested that there was a direct route from being able to understand and produce rhyme to being able to read during the first 2 years at school. They considered phonemes to be rather less important, but they suggested that there could be an indirect route from rhyme through phonemes to reading. Now, this model had a huge impact on teaching practices in the 1990s. If you went into a primary school and looked at children in reception in year 1, you would find that rhyming was the phonological skill that was most strongly highlighted. There was also very strong emphasis in teaching children to read by analogy or word families, so they could learn about word families like sight, might, and light. And they did this often at the expense of traditional phonics. Now, we were interested in this model and we wanted to actually look at really how important was rhyme to reading, and was it really more important than phonemes? So I was the lead author of a paper that was published in 2004 in Child Development, and my colleagues were Charles Hugh, Maggie and James Stevenson. And what we did is we recruited 90 children from Barnet State primary schools when they were 4 years of age and they just entered reception class. These children were followed longitudinally from the ages of 4 up to the age of 6. And there were 3 assessment points at age 4, then again at age 5, and then again at age 6. And what we were interested in doing was charting the development of the children's oral language skills, their phonology or the speech sound analysis abilities, and their reading during their first 2 years at school. The first analysis we carried out is called a principal components analysis. And what this showed us was that rhyming and phonemes are separate and indeed largely independent entities within the phonological domain. And we could show, for instance, that you'd have a child who was good at rhyming but poor at phonemes, and another child who was good at phonemes and poor at rhyming, because they were independent of each other, quite separate skills. But critically, the question we wanted to ask was which of these skills, the ability to rhyme or the ability to segment words into phonemes, was more important in dictating early reading development. So we carried out what's called a path analysis, and that produces a path diagram such as this one. In path diagrams, you work from left to right, and it shows the causal relationships from left to right. So the variables or factors I've entered into this path diagram are as follows. We tested the children's verbal IQ when they were 4 years of age, using oral measures of verbal reasoning and vocabulary knowledge. And we then looked at the impact of verbal ability on the children's rhyming and phoneme skills at age 5. So the rhyming tasks were things like asking the children to produce rhymes. How many words can you think of that rhyme with the word cat? And the child would say sat, fat, lat, and so on. And the phoneme measure was identifying the beginning phoneme of a single syllable word. So the beginning phoneme of cat is K. So 2 quite separate tasks, one reflecting rhyming skill, one reflecting phoneme skill. And we found there was a significant causal pathway, as indicated by the arrow, between verbal IQ measured at age 4 and rhyming measured at age 5. There was also a significant pathway from verbal IQ at age 4 to phoneme awareness at age 5. And then we looked at the relationship between the children's rhyming abilities at 5, their phoneme abilities at 5, and what impact these phonological skills had on reading a year later. And we found now only one significant causal pathway, and that was between phonemes at 5, reading at 6. There was no pathway between rhyming and reading, which goes against completely what Bryant and Goswami said. They said that rhyming was important. We said that phonemes were more important. But there was another factor that we introduced into our path diagram, and this is children's letter knowledge, their ease of learning the 26 letters of the alphabet, which we assessed when the children were age 5. So now we've got 3 predictors of reading ability. Letter knowledge assessed at age 5, phoneme segmentation ability at age 5, and a new term that we introduced, which was a product term, letter knowledge by segmentation. Now, this was simply a multiplication score. We multiplied the children's letter knowledge scores with their phoneme segmentation scores and came up with this product term, letter knowledge times segmentation, which we thought reflected the interaction of phonemes and letters. And we found that we had 3 significant causal pathways, one between letter knowledge and later reading, one between phoneme segmentation and later reading, and one between the product term and later reading. So these are the factors, letter knowledge, segmentation, letter knowledge, time segmentation, which drive progress during the first 2 years of learning to read. Now, I showed you in one of the previous diagrams that phonological skills like phoneme segmentation and indeed rhyming too are driven by early language development, including vocabulary. So also is letter knowledge. So Maggie Snowling demonstrated in a 2017 paper that letter knowledge is also driven by vocabulary. So we're having oral language, if you like, as the sort of starter of the literacy process. And it's vocabulary skills and oral language skills that drive both phonological awareness and letter knowledge acquisition in the first year of learning to read. Now, what we did find in our study was that phoneme awareness, letter knowledge, and the interaction of phonemes and letters, which is indicated by that product term, at ages 4 and 5, together account for nearly 90% of the variance in learning to read at age 6. What that means is they explain nearly all of the individual differences seen in children's early reading development. We don't need to look any further than phoneme awareness, letter knowledge, and their interaction, but bearing in mind that all of these skills are driven by earlier oral language. So what are the practical implications for this longitudinal study of typically developing children that I've just described? The first thing we can say is that we can very likely use simple measures of phonological awareness and letter knowledge to screen and to identify 5-year-olds at risk of reading problems. It would be a question of spending 10 minutes giving a letter knowledge test and a phoneme segmentation test to a 5-year-old, and you would have a very good idea of how easily they would learn to read. And if a child looks to be doing very badly on these tests, then you can say they're at risk, we need to monitor them carefully, and we may need to put in extra help. A second implication is that we believed that from our results, we could confidently conclude that the role of rhyming in early progress in learning to read is effectively overstated, and that the use of analogies for beginning readers is probably overemphasized. But that's not to say that we wouldn't want to teach analogies later on when children had reached a more advanced level of reading and spelling. What we suggested that it's actually phonological awareness training and phonic decoding instruction which has the greatest salience for early readers. Another important implication that people are not often too aware of is the importance of vocabulary and early language skill. We know that these oral language skills drive progress in developing phonological awareness. It's very important to ensure that if a child arrives at school at age 4 and they have poor oral language skills, then this needs to be recognized and they will require additional oral language instruction. We also wanted to very importantly emphasize as an implication of this study that children who again arrive at school with poor phonological skills should have systematic teaching in phonological awareness. Not all children need phonological awareness training because the vast majority are arriving at school at age 4. They already have good phonological skills. These have just developed naturally during the course of their preschool language development. But there is a sizable number of children who arrive at school age 4 don't have good phonological skills. And these are the children who will almost certainly go on to have dyslexia, and these will need phonological awareness training. It's also very important not just to train phonological awareness and letter knowledge, but to somehow bind or link these two skills together in order to help children establish what is termed the alphabetic principle. Now, this alphabetic principle is absolutely critical because it is the foundation upon which all subsequent word level reading skills develop. What is the alphabetic principle? It's the child's understanding that the sound k she hears in a spoken word is represented in the printed written word by the letter C. Now that seems terribly obvious, but it is the establishment of this simple sound to letter mapping upon which all subsequent progress in literacy is built. So that's my first study and its implications. Let's move on to this next study, which is another longitudinal study, only this time it is with children who are definitely at risk of reading problems because they come from dyslexic families. But before we get on to describing the study, I'd just like to talk about some models of reading. Now, one of the most important models of reading was proposed by Muter in 1996, and this is termed the single deficit model of dyslexia. Dyslexia is a word level reading problem. Children who are dyslexic find it very hard to become accurate and fluent readers. And Muter proposed that you could look at causal relationships in dyslexia if you considered levels of study. So she suggested that if you're going to study the learning difficulty of dyslexia, you need to consider first what's termed the biological level, which is the genetic brain dysfunction. In the case of dyslexia, this is a dysfunction within the left hemisphere of the brain, in particular the connections between the frontal and temporal parietal regions that are to do with language. Now, the biological level filters down the next level to what's termed the cognitive level, which is to do with learning. And in the case of dyslexia, we assume that the cognitive deficit in dyslexia is a weakness in phonological or speech sound analysis skill. And then it all feeds down again to the next level, which is the behavioral or the educational outcome level. In the case of dyslexia, we're looking at children with reading problems. Now, there are a number of important implications from the single deficit model. In a single deficit model, it's assumed that the cognitive modules are all separate and independent of each other, and that they're underpinned by separate and independent brain modules. Now, what that means is that a cognitive model like phonological skill is completely separate and independent of a cognitive model like memory, for instance. They're completely separate and independent, and they're underpinned by separate parts of the brain. So you have a different part of the brain that determines phonological functioning from a part of the brain that determines memory function. This, as it turns out, is incorrect, but that is the assumption of the single deficit model. Now, this, of course, infers that if the cognitive modules are separate and independent, it means that it's a case of either having dyslexia or not having dyslexia. You either have it or you don't. It's all or none. And it means that if you have a phonological deficit, therefore you must have dyslexia. If you don't have a phonological deficit, then you don't have dyslexia. So it's an all or none situation. And it's assumed in the single deficit model that dyslexia is entirely explained by a kind of phonology reading disconnection and nothing else. Now, one of the problems in having separate and independent modules, it means that the co-occurrence of learning difficulties must be extremely rare. In fact, I'll come to show some evidence which shows that it's not at all rare. But if you assume that modules are separate and independent, then co-occurrence of two learning disorders must be a rare event. Let me give you an example of that. If we assume that, say, the incidence of dyslexia is 10% in the population, the incidence of dyscalculia or specific arithmetic difficulties 10%, then to get the co-occurrence rate, you've got to multiply those two figures. So it would be 0.1 times 0.1, and that would be 0.01. So you would expect the co-occurrence of these two learning disorders to be less than 1%. This is not the case. It's much more likely to be 45%. So clearly we're having a lot of problems with this single deficit model. What I'm now going to do is to describe a prospective longitudinal study, and I was involved in phase 4 of this study, that made us rethink the validity of the single deficit model and forced us to move away from it into what we now term a multiple deficit model. This was a study that was led by Maggie Snowley and commenced in 1994. And what they did in this study was a prospective study in which in 1992, 74 children were recruited who were at genetic family risk of dyslexia. What this means is they were born into dyslexic families. One of the parents had dyslexia. And they were also recruited at the same time 37 matched control children who came from families where there was no incidence of dyslexia at all. Now, the children were assessed on a very wide range of cognitive, oral language, and educational measures at 4 points, initially at age 3 years, 9 months when they were at nursery school and hadn't even begun to start to learn to read. At age 6, after they'd had about 2 years exposure to reading. At age 8, when they were in middle primary school. And then again for the final time when they were of secondary age, 12 to 13 years of age. So let's look at the findings of these studies, and I'll explain as we go along how the findings from this study, which commenced during the single deficit model reign, actually led us to rethink the whole situation. So let's look first at phase 1 and phase 2, which is all about language and phonology. So phase 1, this is when the children were aged 3 years, 9 months. They're at nursery school. They have not yet started formal reading instruction. Now, what we found in this study is the at-risk children scored below the control children on a wide range of oral language measures, understanding of oral language and expressive use of language. Now, for most of these children, the deficits they showed were mild. They were pretty subtle. The children certainly did not meet criteria for having a formal diagnosis of developmental language disorder, where a child would have severe language delay disorder. But what is evident from the findings is that many children who will go on to have dyslexia have exhibited early language problems that predate the onset of their reading difficulties. The children were then seen again, phase 2, they're age 6, they're in year 2 at school, so they've already had exposure to print and been learning to read for the last 2 years or so. Now, at this stage, we find that half the children in the at-risk group are significantly delayed in reading relative to the controls. So we look as if we've got an incidence rate of reading delay or disorder of 50%. In the general population, the incidence of dyslexia is only about 5 to 7%. So these children from this at-risk group are significantly predisposed to developing this developmental disorder. The children in the at-risk group also scored well below the control group on measures of phonological awareness and letter knowledge, as you might expect from the earlier study that I described of typically developing children. We then move on to the next phase of the study, phase 3. The children are now 8 years of age. And this phase is when the results came to suggest that we're looking not at an all or none picture of dyslexia, but we're also looking at issues around compensation. Now, the authors predicted, in line with the single deficit model, that at-risk children with phonological deficits would have reading difficulties. However, what they found was very interesting. When they looked at the children at age 8 who were in the at-risk group, 66% of them were experiencing significant across-the-board literacy problems. They had difficulty with reading, spelling. They were described as the at-risk reading impaired group. However, 34% of the at-risk children were actually classified as normal readers. They read at the same level as the control group. But nonetheless, even though they were normal readers, they were showing difficulties in spelling, short-term verbal memory, and phonological skill. And these were described as the at-risk reading unimpaired group. Now, what the authors suggested from these unexpected findings, if you like, that it's not a case of dyslexia being all or none. What we're looking at is continuity. Family risk is continuous. And they also concluded that dyslexia occurs along a continuum of severity, from mild at one end through to severe at the other. It's not all or none. They were also able to come up with some further conclusions. They found that the at-risk normal readers usually had good oral language skills. And it was suggested that these good oral language skills were functioning as a compensatory, sometimes known as promotive or protective factor. So the children who had good oral language skills when they were reading a piece of text were often able to use their good vocabulary knowledge and context and content to help them read words, which a child with poor oral language skills would not be able to so readily do. They also found that the at-risk poor readers had accompanying oral language problems. Now, this goes against the simple phonology reading disconnection as the sole explanation for dyslexia. It looks as though in severe dyslexia, it's not just literacy that's impaired, but also aspects of oral language, even if this is just at a fairly mild or subtle level. So the final phase of the study, now the children are age 12, we're beginning to concentrate on other factors, in particular co-occurrence, the presence of accompanying other learning difficulties. Now, what we found in the at-risk study when the children were age 12 and at secondary school was that 70% of the reading impaired children had other problems. They either had attention difficulties, maths problems, oral language problems, or visual motor difficulties, and sometimes more than one of these. Now, the single deficit model, as I explained earlier, has a great deal of difficulty explaining high rates of co-occurrence. It would assume if the cognitive modules are separate and independent of each other, you should get very low rates of co-occurrence. But we can see from this study that the rate of co-occurrence at 70% is very high indeed. Now, co-occurring difficulties may be essentially two types. You can get a co-occurring difficulty that's a forerunner of dyslexia and predates it. A very good example of this is with a language disorder. So the language disorder will predate the development of the literacy disorder. We know that 50% of children who have delayed preschool language development will go on to develop dyslexia or a literacy disorder. On the other hand, you can have two learning disorders coexisting at the same time. And a good example of this would be dyslexia co-occurring with specific arithmetic disorder or dyscalculia. Now, the other thing that we did at phase 4 of the at-risk study was to look at some non-cognitive factors. Now, we did find in the 12 to 13-year-olds that the at-risk poor readers read far less than the at-risk good readers and the children in the control group. And this reading far less suggested that they were engaging in avoidant behaviour. Because they were finding reading very frustrating and difficult, they understandably didn't want to do it. But by avoiding reading, it reduced their print exposure. They didn't have as much exposure to text as the good readers. And what this ultimately does is to create a vicious circle effect. If you don't read very much, then you don't get the opportunity to practice your reading skills. So your reading problem becomes exacerbated. Another problem of not reading is something that's termed in the literature as a Matthew effect. So that if you don't read very much in adolescence, not only will it impact on your reading ability, it will also impact on your vocabulary growth and development. Because when children are 8 or 9, they're acquiring new words for their vocabulary lexicon through their oral language experiences. From about the age of 11 onwards, they're acquiring new words for their vocabulary lexicon through their reading experiences, because we tend to use much more sophisticated vocabulary in text than we do in our oral environment. So in fact, what happens, these children who don't read don't encounter the sophisticated vocabulary contained in written text. And so over the years, their vocabulary knowledge begins to decline. And this can have a devastating effect on how well they function at secondary school, because their poor vocabulary impacts their reading comprehension. It impacts the quality of their written narrative as well. We also found that at-risk poor readers had rather low self-esteem and some anxiety issues, not surprisingly, because by the age of 12 to 13, they'd experienced quite a lot of fears of failure and frustration, and this understandably impacted their self-esteem and their anxiety levels. So just before I go on to looking at the practical implications of the at-risk study, I would just like to say something a bit more about co-occurrence, shared and non-shared risks. And this is a concept that's been developed by Bruce Pennington, and he explains co-occurrence as due to the fact that genes and cognitive risks are shared across learning disorders, and that explains their overlap with each other. There was a tendency to assume when the single deficit model held sway that you had one set of genes that determined that you were going to become dyslexic and another completely separate set of genes that would determine whether you were going to have a developmental language disorder. This is not the case. You get genes shared across disorders. So the same set of genes can predispose you to literacy difficulties and oral language difficulties. And if genes are shared across disorders, then cognitive risks are too. We find that most children with dyslexia will have phonological and verbal working memory difficulties. So will a lot of children with oral language problems, so the cognitive risks are being shared as well. And that obviously explains the co-occurrence and overlap. It's worth bearing in mind also that genes do not cause learning disorders. It's not inevitable that if you have a set of predisposing dyslexic genes, that you will therefore invariably end up dyslexic. What these genes and cognitive risks do is to create risks of the child developing the disorder, which means there's an increased probability that they will develop the disorder, but it's not inevitable that they do. And genetic risks can be modified and tempered by environmental factors, which can include a very rich home environment, early intervention, good quality teaching, and so on. Now, we can see from the studies that I've described that a phonological deficit is obviously a very high risk factor in dyslexia, but other cognitive risks can play a role as well in individual children, having a weak short-term memory, being a slow auditory processor, and as we've seen already, delayed language. It's also important just to keep in mind something called non-shared risks, which are specific to a given learning disorder. So phonological difficulties you would expect to see in particular in children with dyslexia, but you wouldn't expect to see them in children with a specific arithmetic disorder. So it's a non-shared risk. In the case of dyscalculia, a specific arithmetic problem, a non-shared risk could be, for instance, a deficit in numerosity or number sets, the child's ability to appreciate the magnitude of number. You'd expect to see this kind of underlying cognitive deficit in a child with dyscalculia. It wouldn't be something that you would necessarily see in a child with dyslexia unless they have co-occurring dyslexia and dyscalculia. Now, these risks, these genetic risks, these cognitive risks can always be modified and reduced by positive moderator variables. And these are very often variables within the child's learning environment, home support, intervention, and so on, though they can also be to some extent inherent within the child. So let's look at some of the practical implications from this at-risk study. We've seen that dyslexia runs in families. It's a genetically determined disorder. So when a child presents with a reading problem, it's a good idea to check if other family members have a literacy problem too. So any child that comes from a dyslexic family, you do need to monitor their progress because they are highly at risk. Children with language delay are at risk of later literacy problems. And this came across very strongly in our at-risk study that I've just described, especially if these language problems do not resolve by the time the child starts school. So for children who are entering school with poor oral language skills, these are children who will need to be picked up and they will need to have oral language intervention programs, and for children who are severely affected, even speech and language therapy. Our studies have shown us that assessment of a condition like dyslexia needs to address the multidimensional nature of the literacy problem, so as to capture individual variations in expression. So it's not just a question when you see a dyslexic child and giving them a single word reading test. You need to do more than that. You need to look at their prose reading accuracy, their reading fluency, their reading comprehension, their ability to phonically decode, so that you can get a much richer picture of the variations that you can see from one child to the next. And in terms of intervention, we need to ensure that any child who is presenting as dyslexic during the first few years of school does have access to phonological awareness training, phonic decoding problems, and that these need to very importantly be delivered within a broad literacy curriculum that emphasizes oral language and reading comprehension. In other words, they shouldn't be just skill and drill, they should be integrated in a much broader curriculum, and there must be a strong emphasis on oral language because that heavily drives progress in reading comprehension. We know that reading skills change little after age 8, so for maximum effectiveness during the primary school years, we need to deliver the intervention shortly after school entry. Now, a lot of studies have shown the importance of oral language and literacy together. So there's been an increased tendency to develop teaching resources that can integrate literacy and language together. And this is what my colleague, Dr. Helen Lickerman, and I have attempted to do when we recently produced my special alphabet book, which came out published by Jessica Kingsley last year. And what we tried to do with this book, which is a workbook, a resource workbook for use by parents and also by early years educators, it begins with an alphabet story. So we're teaching children the letters of the alphabet in a very traditional format of the A is for apple, B is for box, C is for cat approach, teaching each individual letter of the alphabet, linking it to sounds and telling a story. The latter 2/3 of the book provides lots of exercises for developing phonological awareness and also oral language, including vocabulary, grammatical knowledge, oral narrative, and so on. And what about the final set of practical implications from the at-risk study? We saw from phase 4 that poor readers don't read very much, and it is absolutely critical that they do read. Poor readers must be encouraged to read. They need to increase their print exposure, because that promotes not only good reading skills, but also good vocabulary knowledge. So we need to build in opportunities and support for children to read on a regular basis. And this may include having to use incentive programs for these adolescents who are very demotivated and disengaged. We know that literacy difficulties persist well into secondary school, so it's important that we don't just gear intervention towards the primary school years. This intervention needs to persist into secondary school. We know that some vulnerable dyslexic teenagers are going to need emotional support in order to address their self-esteem and anxiety issues. And as I very strongly emphasized in this talk, we do need to take account of co-occurring or accompanying learning difficulties. These need to be addressed in their own right. We need to assess them as part of the overall global assessment process, and we need to be able to provide interventions for these co-occurring difficulties, which might include, for instance, math support, could include medication for children who turn out to have ADHD, it could include physical therapies for children who have visual motor and therefore handwriting problems. If people want to follow up some of the work that I've done, which is included in this webinar, I would refer you to my most recently published book, which was published by Jessica Kingsley in 2021. And this is Understanding and Supporting Children with Literacy Difficulties, an evidence-based guide for practitioners. Thank you very much.
Thank you so much, Valerie. That was absolutely fascinating. We're now open for questions, everybody. So please use the chat link to feed your questions in. We have one from Jane Emerson here. Could you comment on the debates that are occurring in the US? The literacy on the YouTube channel, the Literacy View. Disagreements there are between leveled predictable books versus, sorry, somebody's jumped in there. Versus decodable readers. In my view, the decodable readers with regular words help phonic decoding to be practiced versus level readers, which can practice high frequency irregular words. Why the need to disagree? Both can be useful, surely.
Well, we do need both. I mean, the thing is that all reading is underpinned in phonology, whether you're reading regular words or whether you're reading irregular words. Phonology and decoding promote both. reading is basic. There are no separate two routes to reading. We used to think there were two routes to reading. The reading for the skills that you need, decoding skills that you need to read regular words, and the more kind of visual recognition approach that you need for irregular words, but it doesn't appear to be the case. And I think this dual route model doesn't actually hold up anymore. I think we much more related to a connectionist model of learning to read, which is basically saying all words are read the same way. It's all to do with creating connections or mappings, if you like, between sounds and letters. That's how children learn to read. I mean, obviously children do need systematic phonics, and they need it to be integrated with other approaches to literacy that involve targeting not just being able to read words at the word level, but also emphasizing fluency and comprehension and so on. And also recognizing that when you're dealing with spelling in a complex orthography like English, you're going to need to go beyond phonics anyway. You're going to need to use other approaches that emphasize larger sublexical units within words, such as morphemes or units of meaning. So yeah, there's an awful lot of apparent disagreement in the area of reading, but actually, if you look at it, there isn't really that much. And I think if you take a sensible approach, one would realize that.
Yeah, I completely agree with you. It's unfortunate that in education, we've had a history of almost politically competing views, and I think that discussion in the States exemplifies that, doesn't it? Because Wayne Holmes is saying, following the Rose Review in 2006, systematic phonics was embedded in schools across the UK. However, in 2015, PISA found that there was no significant change in average reading scores in England since 2006. In 2020, Geoffrey Bowes found, despite the widespread support for systematic phonics within the research literature, little or no evidence this approach is more effective than many of the most common alternative methods used in schools, including a whole language.
Yeah. I think it depends on how you actually teach the phonics. I mean, this is a thing. The Rose Report emphasized that the teaching of phonics must be systematic. I suspect in a lot of cases it's not systematic. The Rose Report defined exactly what systematic phonics was in a very, very clear and specific way. I'm not sure that it's followed. I think there's a lot of very good meta-analytic research from the United States, including an excellent meta-analytic study that was carried out by Linnea Airy years ago, which showed that systematic phonics is superior to non-systematic phonics and whole word teaching in improving children's reading skills. I do think we need systematic phonics. I don't think it matters whether it's analytic phonics or synthetic phonics. It probably doesn't matter as long as it's systematically delivered, and it must be not a pure skill and drill procedure either. It should be embedded within a broad literacy curriculum that also emphasizes oral language. I think it's not often delivered the right way, really.
No, but it's also fascinating. You emphasize the richness of children's oral experiences in early life have a profound influence on their ability to pick up reading as a skill later on. And I'm thinking throughout your presentation the clear link between the genetic sort of link to reading difficulties as described here, but also surely the social and economic impact. I'd be interested to know whether in your longitudinal studies there was a differentiation or analysis of the social and economic impact on children's experiences.
Yeah,
you understand what I mean.
Right. In our first study, which was the Barnett study of the 90 children, that was a very socioeconomically homogeneous group of children.
Right.
Middle class. So basically 90% of the variance was being accounted for by these cognitive and letter knowledge factors, because you had such a socioeconomically coherent group. But of course there are socioeconomic factors that impact children's reading, and we know that children who come from socioeconomically disadvantaged backgrounds do have lower levels of reading than for children who come from economically advantaged backgrounds. And it seems that it operates in a number of different ways. The thing is that children from socially disadvantaged backgrounds who arrive at school typically have lower levels of oral language skill. They will often have lower levels of vocabulary, not able to express themselves particularly well. And as we've seen, if you've got lower levels of oral language, that is going to predispose you to literacy problems as well. We also know that children from socially disadvantaged backgrounds who arrive at school at age 4 often have poorer phonological awareness skills as well, and poor letter knowledge. The thing is that they're not exposed to early alphabet books and story books during the preschool years, as are the advantaged middle class children. They won't have that rich home literacy environment that you get. Socioeconomically disadvantaged families read less to their children. They don't show them alphabet books. So of course, these children are starting school at age 4, significantly disadvantaged in terms of their oral language, their early phonological skills, and just their experience of print, if you like. So of course, they're going to have more problems, which is why we do need to target these groups. And I know that Maggie Snowling has carried out a number of randomized controlled trials, which have particularly targeted children entering school, 4 and 5-year-olds, socially disadvantaged with poor oral language, and they have been able to demonstrate that if you implement structured oral language programs, phonological awareness training programs, you can significantly improve the reading outcome for these socially disadvantaged children.
Yeah, good, thank you. Anne Bridges asks, can you recommend any effective incentive programs that are effective for teenagers with reading difficulties, dyslexia?
I think one of the biggest challenges that we have is incentivizing children in the teenage years. It's really very hard. I mean, it's totally understandable. If you've struggled to learn to read, you don't want to do it. You don't want to pick up a book because you find it very painful, very frustrating, very challenging. And because you read very slowly, you can't follow what the story's about either. So, you know, they really are disadvantaged in this respect. I don't think there are any actual specific programs for this. I think you just have to be as imaginative as you possibly can and use whatever incentives works for that child, whatever rewards you need to set in place, and lots of opportunity for reading. And if it's not possible for them to be enthusiastic about reading print, then you need to come in from a different angle and start bringing in audiobooks. And I think a combination of audiobooks, real books with incentive programs that emphasize the reward of learning to read, and even if it needs to be linked to pocket money or whatever, that's important. And getting kids onto computers as well, because you get kids who are much more incentivized if they can work with a keyboard or an iPad than if they're having to put pen to paper. So I think you've got to use a mixture of reward schemes, opportunity, technology, audiobooks to see if you can get around this problem of reduced print exposure in dyslexic adolescents.
Good. Teresa Keeley asks a somewhat controversial question. Can you comment on UCL's recent research that says contextualized reading is best, please?
Well, I think that's what you do anyway. I often think these arguments are false arguments, actually.
Yes.
You know, I really think they are. All reading should be contextualized. That's what I've said about phonics. Yeah, you do need phonics. It's the building blocks of learning to read, but you've got to contextualize it. You've got to get kids to learn the basic sound to letter mappings. You give them experience in decoding, and then you contextualize it with real books. And there's no such thing as an alternative methods of teaching to read. It's much more valid, I think, to talk about supplementary teaching methods. Phonics is important, contextualized reading is important, supplementary teaching methodologies for helping children with spelling are important that we use later on, teaching kids to spell by analogy. I know I knocked analogy earlier on for early readers, but it can be very important for older children because you get greater orthographic regularity when you're teaching by analogy. And so you can use analogies for learning to spell later on. You can use units of meaning or morphemes, as Peter Bryant and Teresina Nunes have demonstrated in their excellent randomized controlled trials. You can encourage children to learn words within words. I don't think it's a question of alternative approaches. I think we need to use all approaches when we're teaching kids to read. We need phonics, we need contextualized reading, we need whole books, we need supplementary teaching methods. I don't think it's either or.
No.
But people tend to make it a case of either or. It's a false argument, really.
Yeah, yeah. Paul Callender asked, Paula Callender, sorry, a more specific one. What types of interventions and support is recommended for demotivated teens? Recognize Bowers recommends word study and the use of word matrices help with vocabulary and spelling, but still some phonics with older students?
I think phonics can be quite difficult with older students because they can be awfully resistant to it, which is why I think you need to introduce rather more interesting methods for older kids. But it is a shame if they've missed out on that basic phonic teaching. So phonic teaching you're supposed to do at ages 5, 6 and 7, really. And if you've missed out on it, it is unfortunate. It's quite difficult to bring in later on. But I mean, Peter Hatcher in his early work actually suggested that if you pitch it the right way, you can even do phonological awareness training with adolescents who've missed out on that important skill. You just need to introduce it in a way that adolescents find engaging and use words that are within their kind of vocabulary that adolescents use. You need to tailor it a little bit, but there's no reason why you still can't use these same teaching methods, but you need to orientate in a way that is attractive to a teenager, particularly in terms of the vocabulary you use.
Yeah. Great, thank you. Caroline Wooten is asking, you said in addition to phonological problems, visual motor problems can make dyslexia worse.
Well, it's a co-occurring difficulty and quite a common co-occurring difficulty. We don't really know why visual motor difficulties co-occur with dyslexia, but what it leads to, obviously, are problems with handwriting speed and quality, can also impact organization skills as well, written presentation skills. You do see an awful lot of it, that's true, and it does need to be recognized as a difficulty in its own right. I mean, obviously, the kids who are going to find life easier as dyslexic are the kids that don't have co-occurring problems, and we all see some fortunate children who just have a pure dyslexia. They haven't got anything else, just the literacy problem. But indeed, as I demonstrated with those earlier statistics, 70% of children presenting with particularly severe dyslexia are going to have a co-occurring difficulty, one of which could be a visual motor problem, and that does impact obviously their handwriting, and that will make them reluctant writers. But fortunately, we do live in the age of technology, so hopefully by the time they get into secondary school, they're increasingly using laptops, iPads and so on to help support their writing skills.
Do you, because Caroline is asking about, should we be checking children can write letters correctly? Is there a connection between the ability to encode that reinforces the decoding skills that in the reading or the language acquisition process?
Well, I think we all strongly emphasize multisensory approaches to reading. I mean, that's a kind of given that for any intervention that you use in the field of literacy, you should make it multisensory, that you're using all the sensory input cues for learning. So the auditory channel through hearing and saying the sounds, the visual channel through looking at the printed word, but also the kinesthetic channel through writing the word. So we need to link all three channels in a multisensory way, because that reinforces those connections. And an awful lot of learning to read is about reinforcing connections, of which writing is an important component.
Jane Emerson is saying, I would suggest that spelling rules can supplement decoding and encoding skills. Touch typing can be followed on a program which teaches in groups of patterns to help reading and spelling. What do you think of the addition of touch typing to assist?
I think touch typing is important. I think also spelling rules. I mean, they've been much decried over the years, but in fact, there's some lovely studies that were done by Peter Bryant and Teresina Nunes that really demonstrated very nicely how you could teach spelling rules related to morphemes very effectively. They did a very nice randomized controlled trial in which they were teaching children about the shun endings in multisyllabic words, where if it's ION, then it's linked to a concept such as construction, and if it's an IAN morphemic ending, it refers to a person, as in the word magician. And they had a very nice study in which they had 3 groups of kids. They had one group of children who were taught the ION, IAN words, and they were also taught what the rule was. They were explained to them, if it's ION, it's a concept, an abstract concept. If it's IAN, it's a person. So they were given lots of these ION, IAN words to learn how to spell. They were also taught the rule. Another group of children were given loads of ION, IAN words to write. They were not told explicitly what the rule was. And there were a third group that was a control group. And what was interesting is that both of the experimental groups performed better than the control group in learning spellings, but the group that did best were the children who learned the explicit spelling rule. And I think that's a very nice demonstration in a very scientific way that actually spelling rules do work.
Okay, yeah, good. Erin Caddick is asking, thank you for reminding us of the importance of letter knowledge and phoneme awareness and the need to screen 5-year-olds. What do you think of the dyslexia screeners that are increasingly being used in schools now?
I think screening is a big issue at the moment, and I know that Matt Hancock is recently trying to get through a private members' bill in Parliament for compulsory screening of children at primary school. And indeed, Maggie Snowling and I have met up with Matt Hancock to talk about this. And I think our view is very much in line with the Rose Report view, that ideally you need to draw on a number of sources of information when you screen children. It is possible to screen kids for dyslexia as young at ages 5 and 6. And I mean, one way you can do this is to draw on the knowledge of teachers and get them to observe and to rate children's reading-related behaviour, including their oral language skills. So they can ask questions like, what's this child's vocabulary knowledge like? Do they have an extensive vocabulary? Are they able to put words together orally to make fully grammatically complete sentences? How easy has it been for them to learn their alphabetic letters? Have they managed to build up a sight word vocabulary at the speed you would expect? Do they have an awareness of sounds? I mean, you can, and we've even got some inbuilt screening measures at school. We've got the Early Years Foundation Profile. We've got the phonics screening checklist, which is carried out at the end of year 1. So we already have a bit of screening built in there. And I think if we can get class teachers to rate children's oral language and literacy related skills and use a phonics screening checklist, then that is a beginning. I must admit, I'm somewhat skeptical about some of these computer dyslexia screeners that are being quite widely used, because I do very fine-grained assessments of kids with dyslexia, and I often find that parents will come along with the results of this computer-based dyslexia screen. They don't bear any resemblance to the results that I get, having done a 2-hour assessment with them. So I would question their reliability. I think it's far better to use the experience and observations and rating abilities of teachers in combination with existing measures such as the phonics screening checklist, and maybe bring in 1 or 2 other tests, such as a phonological awareness test, they're easy to do, and also maybe a language screen as well, which I know that Maggie Snowling thinks is very important, that we do need to screen children for oral language difficulties, because these are a particularly at-risk group during the first few years of learning to read. And an oral language screen could be a vocabulary test, the number of words a child knows and can use. It could be something like a sentence repetition test, which is supposed to be a good marker for oral language skill as well. So I think it would be better to use these sorts of observational methods, existing available measures like the phonics screening checklist, and add 1 or 2 other tests. And I think you would get quite a good screen. And I know that Maggie Snowy and Charles Hume are looking at this in some depth, and they have even developed at this stage a language screener, which is online and is being rolled out in a large number of schools and looks extremely promising.
That sounds like an answer to this question, but as Wayne Holmes is asking this question, I think it's just, let's unpick it a bit more. How is dyslexia defined and diagnosed? What is the difference between children who have dyslexia and children who are common or garden poor readers but don't have dyslexia? And in what ways should teaching...
Well, I suppose you have to ask, what's a common garden variety read? I mean, some children fail to learn to read because they haven't had very good, they missed a lot of school, for instance, if they've got medical problems, or there are socioeconomic reasons why they've missed school. For instance, if they come from a traveller family, they could have missed a lot of school. If you miss school, you're going to be a poor reader because reading has to be taught. So that could be a factor for not being able to read. You might have difficulty learning to read because you've got a language delay or disorder, and that's going to predispose you to reading problems. Strictly speaking, to be a true dyslexic, you should have a word level reading problem that is associated with underlying phonological processing difficulties that leads to decoding problems. That's a classical sort of dyslexia. You have to, of course, differentiate dyslexia or word level reading problems from children who've got reading comprehension difficulties, because there is a group of children who can actually read print pretty accurately but can't understand and remember what they read. Now, these are children who are described as poor reading comprehenders, but invariably these are children who have underlying oral language problems. So you need to look at each individual child and just see, why is this child not reading properly? Is it because they haven't had sufficient exposure to print and have been disadvantaged in some way in terms of their learning experiences? Is it because they have dyslexia, which is the classical word level reading problem caused by a phonological deficit? Is it because their poor oral language is causing them to find it difficult to learn to read? Is it because they've got English as a foreign language, which will have slowed them up as well to some extent? Is it because they've got a reading comprehension difficulty? So you have to unpick it all, I think, through assessment to determine what particular factors contribute to that individual child's learning problems.